Attention deficit/hyperactivity disorder, ADHD, is a neurodevelopmental disorder that commonly begins in childhood and often continues into adulthood. It is characterized by a pattern of inattention and/or hyperactivity impulsivity that interferes with functioning or development. ADHD is one of the most researched mental health disorders, yet it remains widely misunderstood. This summary aims to elucidate the symptoms, causes, diagnostic criteria, and management strategies for ADHD, providing a thorough understanding of this complex condition. Symptoms of ADHD. ADHD symptoms are generally categorized into two main areas: inattention and hyperactivity impulsivity. These symptoms can vary widely from person to person and often change over time. Inattention. Difficulty sustaining attention in tasks or play activities. Frequent careless mistakes in schoolwork, work, or other activities. Seeming not to listen when spoken to directly. Failing to follow through on instructions and failing to finish schoolwork, chores, or duties in the workplace. Difficulty organizing tasks and activities. Avoiding or being reluctant to engage in tasks that require sustained mental effort. Losing items necessary for tasks and activities, for example, toys, school assignments, pencils, books. Easily distracted by extraneous stimuli. Forgetfulness in daily activities. Hyperactivity impulsivity. Fidgeting with or tapping hands or feet, squirming in seat. Leaving seat in situations when remaining seated is expected. Running or climbing in situations where it is inappropriate. In adolescents or adults, this may manifest as restlessness. Inability to play or engage in leisure activities quietly. Being on the go or acting as if driven by a motor. Talking excessively. Blurting out answers before a question has been completed. Difficulty waiting for their turn. Interrupting or intruding on others, for example, butting into conversations or games. Types of ADHD. ADHD is divided into three types based on the predominant symptoms. ADHD, predominantly inattentive presentation, individuals primarily exhibit symptoms of inattention. ADHD, predominantly hyperactive impulsive presentation, individuals primarily exhibit symptoms of hyperactivity and impulsivity. ADHD, combined presentation, individuals exhibit a combination of both inattention and hyperactivity impulsivity symptoms. Causes and risk factors. The exact cause of ADHD is not fully understood, but it is believed to result from a combination of genetic, neurological, and environmental factors. Genetic factors. ADHD tends to run in families, suggesting a strong genetic component. Studies have shown that parents and siblings of a child with ADHD are more likely to have ADHD themselves. Neurological factors. Brain imaging studies have revealed differences in the brain structure and activity of individuals with ADHD. These differences are particularly notable in areas of the brain involved in attention, impulse control, and executive function. Environmental factors. Several environmental factors are associated with an increased risk of developing ADHD, including prenatal exposure to alcohol or tobacco smoke, premature birth, low birth weight, and exposure to environmental toxins like lead. Psychosocial factors. While not direct causes, psychosocial factors such as family stress, high levels of conflict, and inconsistent parenting may exacerbate ADHD symptoms. Diagnosing ADHD involves a comprehensive evaluation by a healthcare professional, typically a psychiatrist, psychologist, or pediatrician. The diagnostic process includes clinical interview, a thorough interview with the child, or adult, and their parents or caregivers to gather detailed information about the individual's behavior, symptoms, and history. Behavioral assessments. Standardized rating scales and questionnaires are used to assess the severity and frequency of ADHD symptoms. Common tools include the ADHD rating scale and the Conners rating scales. Observation. Direct observation of the individual in different settings, such as home, school, or work, to evaluate behavior and interaction patterns. Medical examination, a physical examination and review of medical history to rule out other conditions that may mimic ADHD symptoms, such as thyroid problems or sleep disorders. Criteria fulfillment. The diagnosis is based on the criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which requires that symptoms be present for at least 6 months, occur in multiple settings, and significantly impair social, academic, or occupational functioning. Impact on life. ADHD can have a significant impact on various aspects of life, including academic performance, social relationships, and mental health. Academic performance. Children with ADHD often struggle in school due to difficulties with attention, organization, and completing tasks. This can lead to poor grades, increased need for special education services, and higher dropout rates. Social relationships. ADHD can affect social interactions, leading to difficulties in making and keeping friends. Impulsivity and hyperactivity can result in social rejection and conflicts with peers. Mental health. Individuals with ADHD are at increased risk for co-occurring mental health conditions such as anxiety, depression, and conduct disorders. These conditions can exacerbate ADHD symptoms and complicate treatment. Occupational functioning. Adults with ADHD may face challenges in the workplace, including difficulties with time management, organization, and meeting deadlines. This can lead to job instability and lower job satisfaction. Management and treatment. Managing ADHD typically involves a combination of behavioral interventions, educational support, and medication. The goal is to reduce symptoms, improve functioning, and enhance quality of life. Behavioral interventions. Behavior therapy. Behavior therapy focuses on modifying negative behaviors and developing positive behaviors through reinforcement and consequences. Techniques include token reward systems, timeout, and behavior contracts. Parent training. Training programs help parents develop skills to manage their child's behavior, establish routines, and use effective discipline strategies. Social skills training. Social skills training teaches individuals with ADHD how to interact appropriately with peers, communicate effectively, and resolve conflicts. Educational support. Individualized Education Plan, IEP. An IEP is a customized educational plan for children with ADHD, outlining specific accommodations and support services to meet their needs. 504 Plan. A 504 plan provides accommodations in the general education classroom, such as extended time on tests, preferential seating, and modified assignments. Tutoring and academic coaching. Extra academic support can help children with ADHD stay on track with schoolwork and develop effective study habits. Medication. Stimulants. Stimulant medications, such as methylphenidate, Ritalin, and amphetamines, Adderall, are the most commonly prescribed treatments for ADHD. They work by increasing levels of dopamine and norepinephrine in the brain, which help improve attention and focus. Non-stimulants. Non-stimulant medications, such as atomoxetine, Strattera, and guanfacine, Intuniv, are alternatives for individuals who do not respond well to stimulants or experience significant side effects. Antidepressants. Some antidepressants, such as bupropion, Wellbutrin, can be used off-label to treat ADHD symptoms. Lifestyle and self-care strategies. In addition to professional treatment, several lifestyle changes and self-care strategies can help manage ADHD symptoms. Healthy diet. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can support overall health and brain function. Some individuals with ADHD benefit from avoiding foods with artificial additives and high sugar content. Regular exercise. Physical activity can help reduce ADHD symptoms by increasing dopamine and norepinephrine levels in the brain. Activities such as swimming, cycling, and team sports can improve focus and reduce hyperactivity. Adequate sleep. Good sleep hygiene practices, such as maintaining a consistent bedtime routine and avoiding screens before bed, can improve sleep quality and reduce ADHD symptoms. Mindfulness and relaxation techniques, mindfulness meditation, deep breathing exercises, and yoga can help individuals with ADHD develop better self-regulation and reduce stress. Time management skills, tools such as planners, to-do lists, and reminders can help individuals with ADHD manage their time more effectively and stay organized. Structured environment. Creating a structured environment with clear routines and expectations can help reduce distractions and improve focus. Challenges in treating ADHD. Treating ADHD can be challenging due to several factors. Co-occurring conditions, the presence of other mental health conditions, such as anxiety, depression, or learning disabilities, can complicate the diagnosis and treatment of ADHD. Medication side effects. Stimulant medications can cause side effects such as insomnia, appetite suppression, and increased heart rate. Finding the right medication and dosage can be a trial and error process. Adherence to treatment. Individuals with ADHD, particularly adolescents and adults, may struggle with adhering to treatment plans, including taking medication regularly and attending therapy sessions. Stigma. The stigma associated with ADHD can prevent individuals from seeking help and support. Misunderstanding and misconceptions about ADHD can also lead to negative attitudes and discrimination. Variability of symptoms. ADHD symptoms can vary widely among individuals and may change over time, making it challenging to develop a one-size-fits-all treatment approach. Research and future directions. Ongoing research is essential for improving our understanding of ADHD and developing more effective treatments. Areas of focus include genetic studies. Identifying specific genes associated with ADHD can help in understanding the genetic basis of the disorder and developing targeted interventions. Neuroimaging. Advances in brain imaging techniques, such as functional MRI, can provide insights into the neurological differences in individuals with ADHD and help refine diagnostic criteria. Non-pharmacological interventions. Research into non-pharmacological interventions, such as neurofeedback, cognitive training, and dietary modifications, may offer alternative or complementary treatment options. Long-term outcomes. Longitudinal studies tracking individuals with ADHD from childhood through adulthood can provide valuable information about the long-term impact of the disorder and the effectiveness of different treatment approaches. Personalized medicine. Advances in personalized medicine, including pharmacogenetics, hold promise for tailoring treatments to individual genetic profiles, potentially improving treatment efficacy and reducing side effects. In conclusion, attention deficit/hyperactivity disorder is a complex and multifaceted condition that affects millions of individuals worldwide. Understanding the symptoms, causes, and treatment options for ADHD is crucial for improving the lives of those affected by this disorder. While challenges remain in diagnosis and treatment, ongoing research and a comprehensive approach to management offer hope for better outcomes. By fostering awareness, reducing stigma, and promoting evidence-based interventions, we can support individuals with ADHD in achieving their full potential and leading fulfilling lives. Thank you for watching. Please subscribe, like, and share.